Hello everyone, it's Matthew McKenzie here again, raising awareness of unpaid carers, especially those caring for someone with long-term mental illness. Although, to be honest, a lot of the video lectures that I do can be applied to other forms of unpaid care. It doesn't have to be mental health. You can just take what you think might be useful. So for this one, we are looking at carers' rights. And you might think a carer's rights might resolve around getting a carer's assessment, getting some form of financial support, getting a form of respite. But carer's rights are vast and complex. And the number one rule when it comes to caring for someone who's close relative with long-term illness is information. If you know your rights, if you have information, it's the first step to knowledge. And good knowledge is a form of power, but you can't develop this by yourself. Obviously, you have to ask those who are in the know, and they would be what we call advocates. There are many different types of advocates. You've got mental health advocates that might be based at voluntary sector, community organizations, could be Mind, could be Rethink. You've got carer advocates that would be based at your care center, your local care center. um, Even advocates at mental health hospitals, hospital trusts, independent mental health advocates, approved mental health advocates. But we're going to focus on advocates that are knowledgeable regarding unpaid carers. And again, this will be more focused on mental health carers. And what I mean by that term is that you care for someone with a long-term mental ill health. That could be a form of psychosis, eating disorder, self-harm, addictions, that type of thing. So it's a fairly long lecture, around about 20, over 20 slides I have here. I'll try and make it brief as I can, because I do understand that not everyone has the time to sit and watch these things, and I will put it into a blog if you don't want to watch the video, but the blog will only be really brief, really. So let's begin. Questions you should ask. um, an advocate, and we'll probably put this advocate perhaps in a carer center that has knowledge about mental health law, carers law, the Care Act 2014, Health and Social Care Act 2022, things like that. Before I do continue, I'd like to say, if you can, if you want to, and you don't want to miss any useful updates on videos, please subscribe. I'll remind probably at the end of this video lecture as well. Let's continue. These these questions are non-tailored, by the way. So obviously, when you're seeking advice from someone who specializes or advocates also for someone with mental illness, asking the right questions can actually ensure that your loved one or the person that you're caring for, and this includes you, obviously, get the right support, resources, and information needed to navigate the challenges of caregiving or unpaid caring. So I think maybe around about 26 questions, but there's a whole lot more, but I've tailored them down to the most important ones you should be asking. Like, don't waste your time going to a chaos advocate and sit there listening and not really focus on the really important questions that might save you a lot of trouble in the future. So the first one, you want to ask them if you're going to a care center or an inpatient ward or a community mental health team, and you speak to the carer's lead, care support officer, is, what services do you provide specifically for carers of those caring for someone with mental illness? The reason to ask this is that you want to understand the scope of services, such as, do they offer legal assistance? Which should only be, I would think, most of the time fairly brief. If you want to go down that road, you're more likely to be looking at a solicitor. Do you provide services that can refer to, sorry, to support groups? Or ways to navigate the healthcare system, which will help determine if the advocate you meet, can help you. Remember, at the start of this lecture, there are different types of advocates. They are not the same. They're all different. This one, though, I've narrowed down to perhaps they may be at the carer centre. They might work there, or they work for your local NHS mental health trust. So these are the two advocates I'm focusing on, and they are carer advocates. So before you start asking questions, first thing you should ask is, what services do you provide specifically for carers of those caring for someone with mental illness? And I'm talking about unpaid carers like family or close friends. Next thing is, what experience or training do you have in supporting carers of individuals with mental illness? Now, this gives an insight into the type of knowledge they have of that specific mental health condition, or even common care challenges and experience with similar cases. Not to say if they say we didn't have that much training, I don't think that's a big problem, really, but it does give you an idea of the wealth of knowledge they may have. And if it starts going down the legal route, then yeah, you would expect a lot more training. Some mightn't have any training, but have lot of experience. So, don't be put off by that either, because it does sort of, you think to yourself, okay, I won't waste my time asking this question, I'll ask something else. The other one is you want to ask is how do you typically work with carers and what is the process for receiving the support you give? And this is clarifying, what to expect in terms of how often do you meet them? Would they be open to a meeting on updates, or would they say, no, you got a book? Communication style, is it informal or formal? Hence, would they provide notes or would it be relaxed? Steps that involved in receiving assistance, would they come along with you to a meeting? Or would they sort of say, you're going to have to get your own form of support, but they just give you the information like that? What financial or practical support options are available to you as an unpaid carer if you're asking an advocate? And advocates, they might often know about this type of thing. If they do, they'll, you could ask them if it's things like respite or subsidies or CARES grants. And the reason I'm saying CARES grants and respite is they definitely would know if they're based at a care centre, because they're more likely to be offering it, or financial aid for carers. So think about that. The reason why this question is really important is if you're caring for someone long term, you will more likely be needing some form of financial support in the future. This is one of the biggest things that impact unpaid carers, hence the term unpaid. So it's a very important question to ask, and don't put this off. And going forward, I will say when a question is important, I'll note that down. Some questions I don't think are that important. They might be useful to ask, but other questions are a must have in order to ask. And this is one of them. Again, there's another one. What, are there local support groups or workshops or programs for carers of people or loved ones with mental illness? So obviously the advocates will hopefully will say yeah, and they should refer you to a care support group, programs that can provide community emotional support, practical caregiving strategies. Absolutely important, that type of question. The reason I say this is that when you start off as a mental health carer, you're not really trained for that role. So you're sort of learning on the ropes. And if you're doing that, you're going to make a lot more mistakes. Obviously, there's a lot on the line. So it helps to be guided and be supported as well, and be given information on what things to look out for and emotional support for yourself, just to let you know your own mental well-being is at risk when you're caring for someone with mental ill health. So a very useful question to ask. Another thing is, how can you as a carer access mental health services for yourself and the person you care for? This should be part of a care plan that's provided to your loved one, to be honest, but it doesn't hurt to ask a carer advocate. Advocates often have connections or recommendations for therapy, counseling, and crisis service, especially if they're working in a mental health NHS trust or even a private mental health provider. So again, quite a useful question to ask. What are my rights as a carer, and what legal protections exist for carers of individuals with mental illness? Sort of a question you may even ask a solicitor, but care advocates working in mental health trusts are more likely to know as well. Obviously, knowing your rights can empower you in dealing with healthcare providers, employers, and social services. So there's a mixture. They all should have um, knowledge of this thing. Obviously, you would want to know your carer's rights in case someone impedes on it. The other side to this, though, is it also depends who you ask. I do find that you're more likely to get a better response if you're asking someone at a care centre who's got mental health background compared to a trust. And this is political, a trust that's not providing the best type of services. And the reason that might sort of happen is there can be a culture of pushback. They might not tell you your full rights as a carer. So I'm not saying this is across the board. That's wrong, but you might get one or two bad apples out there. I'm just saying, do take note of this. Legal documents. Obviously, this is something you might want to be asking. You should really, to be honest. What legal documents should you as a carer consider preparing, and how can a carer's advocate assist with these? Take note. I don't. You might be, if you're lucky, you may get an advocate that will actually assist to a point. Um, Depends on the document, but you should be asking. And this is another lecture for another day. There are a lot of documents you should consider if you are caring for someone with mental ill health, and it does depend on the mental health condition. An advocate or a care advocate can actually guide you on important documents, like power of attorney, healthcare advance directives, financial management tools, and there's a whole lot more. But you should be asking this particular question to prepare for the future as well. Safety planning, emergency listing, support on care plans. Another one is, how can you actually advocate for the person needs within the healthcare system, especially during treatment planning or hospitalization? So you're actually asking an advocate to give you the empowerment on how you can advocate for your loved one. This is important for ensuring that your loved one receives appropriate care, especially during hospital visits or treatment adjustments. The other one is, what strategies can you as a carer use to establish and maintain healthy boundaries in your caregiving role? Now, without a doubt, this is probably the most common um, questions you should be asking an advocate, but can be tricky because the nature of unpaid care is that you put yourself last and the person needing the care first. That's the sort of culture of an unpaid carer. So, but it's important. Carers need to maintain healthy boundaries, and advocates can offer advice or resources on setting boundaries to prevent that carer burnout and protect your physical and mental well-being. The one is, how can I advocate as a carer for support and respite without guilt? Not a common question, this one, but it's very important. An advocate can help you build skills to confidentially request the breaks and support needed for sustainable caregiving. And yes, there's a lot of guilt and a lot of stigma in mental health caregiving. What should I, as a carer, know about mental health laws and policies that impact my role or the person I care for? And the big one, as of 2025, is obviously the revamp of the Mental Health Act, which is definitely going to impact unpaid care, especially if you're the nearest relative. And there's a few other things as well. So yes, you will definitely want to be asking an approved mental health worker on these types of things. In fact, they would perhaps want to be speaking to you. So it's very important you be asking them that. I believe it's going to take maybe 2 to 10 years training for mental health trusts to get up to speed with the changes in the Mental Health Act. And this should be told to care. In fact, at some point, I have in one of my groups engagement from the director of health and social care, well, actually social care, and one of those things they will be clued up in is mental health law. Something I would say carers need to, especially if your loved ones use the mental health services at an NHS trust, carers need to know. But in the meantime, you want to be asking an advocate this type of thing, especially if your NHS trust has a mental health act department. So understanding mental health laws such as involuntary treatment, patient rights, confidentiality rules can help you better navigate the system. You don't ask this, you're in for a while to hurt. So it helps to try and get up to speed on these things. Unfortunately, mental health act is complex. So don't be led astray on this thing. Very important question to ask, by the way, especially if your loved one's going to be discharged from an inpatient ward into your care. What should I do if I disagree with healthcare providers? And I'm talking about NHS Mental Health Trust, but again, acute providers as well, about treatment for the person I care for. And there's a lot of things you can do, but you want to be asking this sort of type of thing. This helps you know, obviously, the options for resolving conflicts or seeking a second opinion within the healthcare system. And it's important you ask this, that even though it's healthcare professionals, they don't always get it right. So you might want to seek a second opinion just in case and other conflicts you're not sure about. The other one is, how do I access crisis intervention services, and what should I do during a mental health crisis? Again, I should have put this one in red because it's one of the most important questions you should be asking um, when you're caring for someone with mental health needs. It's only a matter of time. God forbid, it might never happen, but often there may be a chance of relapse. You must do your best to prepare if things go down that route. You never know when it may happen, but there's always the chance. So knowing how to contact crisis intervention service and what to expect during a crisis can actually help ensure the safety and stability of everyone involved. That includes yourself and your loved one. What resources are available to help with long-term planning for the person I care for? And there are a lot. It helps to, again, ask this. This could be information on assisted living, disability benefits, or guardianship if needed. How can I prepare financially for the future, given the demands of my caregiving role? Advocates that might know about such resources for financial planning or assistance specifically for unpaid carers. How can I balance my own mental health and well-being with my caregiving duties? This helps ensure the advocate is aware of your need for self-care and personal support resources. This actually ties in as one of the most biggest questions you would get out of a carer's assessment. And usually advocates might sort of respond by saying to you, have you had a carer's assessment? So that should be flagged up in there. And I do think carers should prepare for carer's assessment. They shouldn't be just bang, you have that carer's assessment and that's it. I think that's the wrong way of going about it. But again, it's important. Very important question to ask. What are the effective ways to cope with the emotional stress of caring for someone living with mental illness? Now, an advocate may suggest self-care practices, counseling options, or resources that address caregiver fatigue, and you will get it, and emotional stress. If you have effective ways and strategies to cope, this will lessen the situation of care burnout, care fatigue, and emotional stress. Are there any counseling or mental health support services available for unpaid mental health carers? So carers sometimes benefit from mental health support. Advocates can actually help locate specific carer counseling services that are out there. Not easy to find, but they are there. What is your approach to confidentiality and privacy? So knowing how the care advocate can handle your and your recipients or the cared for's information is essential for establishing trust. You more likely will ask that if you're asking someone that's working in the NHS trust. Not, I don't think it's the most asked question, but confidentiality is can be an issue. You've got two types, obviously, the care confidentiality and your loved ones. If it's at an NHS trust, you definitely want to be asking this one because there can be problems when care confidentiality could be breached. So do ask this one. But if it's a care centre, then it's less likely. They'll more likely be advocating for you mainly, to be honest. What are the costs associated with your services, if any? And I doubt that if you're having to pay for this, then you're probably doing it out of desperation. Most of the time, I don't think this is the case, unless it may be a solicitor. Some advocacy services may actually have fees, while others, most of the time, if it's NHS, it's going to be free. Understanding any costs involved will help with budgeting and planning. And again, there are, really good services out there if you have the money, but you want to budget if you're doing unpaid care. How can I contact you or access further support if my needs change? So obviously this is clarifying communication methods and follow-up options that helps ensure you can reach out if things involve, whether it be email, phone. Do you physically have to get support on site? So these types of things. So coming to the end, and why are these questions important? There's no way you're going to ask them all in one go. Obviously not. You take and pick what you choose might be useful when you see a care advocate. But these questions, they can help you understand the available support, your carer's rights and resources while establishing a supportive relationship with the care advocate or the advocate. Obviously, being clear on these topics empowers you. They really empower you to navigate the mental health system effectively, advocate for the cared for your loved one, advocate for themselves, and access the tools needed to provide sustainable care. So with that, I'd like to say, thanks for taking the time to watch this video lecture. I hope it's been useful. If it has been useful, please give it a like, subscribe for more care lectures, especially mental health as well, new stuff on cancer and combating discrimination, health inequality videos in future. And leave a comment in the chat about what sort of questions you feel would be useful that I've presented in this video. Now, you take care and look after yourself.